Hello, everybody. Medicare Dave here from the Senior Healthcare Team, and I wanted to make a quick tutorial video really highlighting the differences between original Medicare and Medicare Advantage because this is so commonly misunderstood. I'm going to go ahead and share my screen. And there are four different parts of Medicare, and I want to go over this just briefly before we get into the differences between original Medicare and Medicare Advantage. You have Medicare Part A, which is your hospitalization coverage. This is actually inpatient care in the hospital. Medicare Part B, I like to say this is everything else. This is your doctors, your specialists, lab work, MRIs, CAT scans. Literally everything other than being an inpatient in the hospital is covered by Medicare Part B. Then you have Medicare Part C, which is not part of original Medicare. This is actually a substitute for Medicare, which is called Medicare Advantage, and we'll get into that a little bit more, but this is an alternative to Medicare. And the fourth part is Medicare Part D. This is your prescription drug coverage. So let's talk about, there's two different avenues that you can go down with respect to how you get your coverage through Medicare. It's one or the other. So the first is original Medicare, which consists of Medicare Part A, your hospital coverage, Medicare Part B, your medical coverage, Medicare Part D, your prescription drug coverage, and then most people will add a Medigap or Medicare supplement plan. Medigap and Medicare supplement are the same thing. And what that does is it covers some or all of the costs that Medicare alone doesn't cover. So that's one way to get your coverage through Medicare, and we like to call that the smart Medicare model. The other alternative is Medicare Advantage, known as Part C, where you give up your Medicare coverage in exchange for going into a managed care plan that covers some of the Part A hospital coverage, some of the benefits of Part B, some prescription drug coverage, and might even add some other benefits like dental and vision or a gym membership, but they're enticing you to give up your Medicare, your medical and hospital coverage through original Medicare in exchange for inferior medical and hospital coverage, but some other benefits. So you got to be really careful with Medicare Advantage in thinking that you're getting more because you may end up be getting less because you're giving up all of the protections under original Medicare in exchange for some other little freebies that they throw in. So the smart Medicare model, again, is what we call Medicare Part A and B, prescription drug coverage, and a supplement plan. Why do we call it a smart Medicare model? Let's talk about original Medicare. With original Medicare, you have national coverage. It's the same anywhere in the United States that you happen to be traveling to. You get to choose your doctors. You get to choose your hospitals. You can choose any doctor or hospital or provider that accepts original Medicare, which is the widest accepted of any kind of insurance in the country. Approximately 95% of all providers in the United States accept original Medicare. There's no referrals needed to see specialists. Your coverage is guaranteed renewable for life. You can never lose your coverage for any reason other than failing to pay your premium. So no matter what happens to your health, as long as you make your monthly premium, your coverage is guaranteed for life. And you can change your plan at any time. With Medicare Advantage, on the other hand, you typically do not have national coverage. The plans vary from county to county. You might not even be covered in the entire state that you live in. It might just be specific counties that are local to your zip code. You typically will always need referrals to see specialists. You have to go to your primary care doctor and get a referral in order to go see that specialist. You may have other restrictions such as prior authorizations. You can only go to doctors within that Medicare Advantage plan's network. You're typically going to pay co-payments when you go to your primary and higher co-payments when you go to a specialist. And you might even have other out-of-pocket costs such as co-insurance, where your plan will only cover for example, 80% of a bill, and then you're still responsible for the 20% co-insurance. Your doctor can leave your network at any time, making it very risky. The hospital may leave the network at any time, and your plan can be canceled at any time. These plans are not guaranteed renewable, whereas Medicare Advantage, original Medicare, you're covered for life as long as you make your premium. These Medicare Advantage plans are one-year terms, and they change the terms, conditions, networks each year. As well as you can only make changes to your plans at specific times of the year. You're locked into these plans. So again, two different options. You either get original Medicare or Medicare Advantage. It's one or the other. So with original Medicare, there are different types of Medicare supplement plans or Medigap plans that you can add. Some are less expensive, some are more expensive, some cover more, some cover less. You should compare those wisely. Or you go with a Medicare Advantage plan where you are giving up your coverage run by and protected by the federal government in exchange for a managed care plan like an HMO or PPO that has limited coverage. Some of the drawbacks to Medicare Advantage plans, again, it's a restrictive network of doctors and hospitals. You don't have national coverage. The provider could leave the network at any time. Your plan can be canceled at any time. You're going to pay co-payments. Strict rules like referrals and pre-authorizations. The insurance company sets the rules and you have to play by them. And your insurance company, your health plan, decides what tests and procedures are approved for you, as opposed to letting your doctor or provider decide what is medically necessary for you. And these plans typically have much higher out-of-pocket costs, and you are locked in. You can only get out of your plan at a set time of the year. Why choose original Medicare with a standardized Medicare supplement plan? You can keep or choose any doctor that accepts Medicare patients, the widest accepted insurance of any in the United States. You can see specialists without a referral. National coverage that travels with you anywhere in the United States. Doesn't matter if you live in Florida or Hawaii or you're traveling to Puerto Rico or Albuquerque, New Mexico, your coverage travels with you. With the right Medicare supplement plan, you can have none or very limited amounts of copays, help paying deductibles. Coverage is guaranteed for life, and you can change the plan any time of year that you want. This is what we consider the smart Medicare model. Again, I'm Medicare Dave from the Senior Healthcare Team. If you have questions at all, please leave them in the comments below in this video. If you'd like to hear other topics discussed in an upcoming video, please leave your feedback below as well. And if you'd like to watch a longer and more detailed Medicare tutorial video, please go to MedicareDave.com. Click on the white box that says on the homepage that says Learn More, Watch Medicare Videos, and we've got lots of good, helpful information there. Look forward to seeing you all in an upcoming video, and I hope that you're staying healthy and safe.